Way back when, before hospitals and clinics, we would do home births, or we would birth in a lodge or a teepee with the earth. You know, our feet would be grounded on the earth. You would have people already supporting you during that whole sacred ceremony of pregnancy and birth. And after that, you know, the birth of the placenta, and that is when lactogenesis starts, but that's also when we would start skin to skin, and that's the first step in that special bond between parent and baby.
Our ability to nourish our children from our own bodies utterly spontaneously is such a miraculous gift of creation that comes down from our ancestors, okay? So that we have this holy science then of nursing and nourishing our children with our own bodies.
I knew that I was pregnant, and I knew that I was going to breastfeed. It was something that I didn't even consider bottle feeding, because in my family, it has been passed down for generations that we were all breastfed. So my mom to me, my grandma to my mom, my great-grandma, so on.
Traditionally, the wet nurses, I have a story from my own family. I guess my great-grandmother was a wet nurse to one of her cousins. So yeah, if a mother needed breast milk for her child, because seriously, not every woman can breastfeed. It's true. So that support from another mother who might have an abundance of milk was there. And so we got through it as a community.
So when I was pregnant, when I found out, me and my husband, we decided that we wanted to do something as close to traditional as we could. And so in pregnancy, that's when we said, let's do this in a good way. Let's do our very best to bring these traditions and normalize them. And so I did a lot of the protocols around pregnancy. There's just so many that I didn't know about, I wouldn't have known that without my mother-in-law, who is a nurse midwife. She's Potawatomi, and her name is Beth. And she's really well known in Michigan because of the work she's done over several years, probably my lifetime in birth work and being a midwife and helping mothers lactate and do breastfeeding, chest feeding. So it was from that time that we knew we also wanted to do breastfeeding. It was just going to be like, that was a part of it. We were like pros the first 4 days of breastfeeding, no problems whatsoever. He was just a champ at breastfeeding. It didn't work the way it did those first few days. We had so many problems with latch. I cried. I wanted to quit. I said, I can't do this anymore. I was crying, baby was crying, we were both crying. I was by myself because my husband was in school, and I just broke down and was like, I can't do this. This is so hard and it hurts. And so I called up my mother-in-law, and I was in tears, and I was like looking up videos on YouTube and all these resources about latch and like how to do it properly. But I called my mother-in-law and let her know, like, this is so hard, it hurts, I don't know what's wrong with me. It hurts to latch, like I scream, it just is painful. And she told me, let's take a deep breath, let it out. You are doing such a great job. You are healthy, your baby knows what he needs, and your body knows what baby needs. You are doing a great job, and you can do this. All right, let me know what's going on, and let's see what we can do. And that was all I needed to calm down, to get out of that negative narrative that I was telling myself.
So as a mother, I have 4 children, and each of my children had different experiences as far as breastfeeding them. My oldest, we couldn't do it, and she was my firstborn. I ended up expressing my milk and giving it to her for a month, and that was it. I had no support with her, none at all, and that was in 1999. 6 years later, I had my son, and there was a whole bunch more support. We struggled. We had to use some kind of adaptive to help him latch on. So we did that for 6 months, and then my doctor told me to stop because I was pregnant with the next child. And so I stopped feeding my son, and he had it for 6 months. I breastfed him for 6 months. Summer Rain, my next child, I breastfed her for a year, and we didn't have too much problems. She was a snacker, so we got it.
What was it to have a traditional birth? And now, because of the hospitals and things, like, you have to factor in everything that's going on in this life at this moment. And so for me, a traditional birth was not outside or in a birthing lodge. It was in a hospital, and it was hard, and it was messy, and it was like we did as much of our ceremony as we could, but we can't incorporate everything. And so, like, figuring out, outside of the hospital, what does that mean? Where do I bury my placenta? And even that hasn't happened. I'll be honest, it's still frozen. But we get to decide these things and figure out what to do with them. I think it's really about making a decision about doing what's comfortable for you. And I know for some moms that's breastfeeding for the first week, for the first month, for the first year. And for me, it's really, I'm kind of letting me and Nana decide together what makes sense for us. And so she is still breastfed. And I feel really blessed that this COVID year means that we've had a lot more time together and a lot more time to bond and more time to understand each other. And for, I know other moms, I know that's different. And really figuring out how to listen to your own body, but also not be swayed by other people's opinions. I know that for me, I was told a lot that I'm gonna rot my baby's teeth out. It's not okay to do after a year. Now I'm just being selfish, things like that. So I really had to push those aside and decide, okay, I have to figure out what's best for me and my baby. And there were a lot of challenges, but it was things that I was actually able to work through. It wasn't anything that was very final. I know the hospital will try and scare you and say you're not producing enough milk. And we actually asked for donor milk. So we supplemented her with donor milk until we got out of the hospital, and then I just breastfed as much as I could. And her weight, she started gaining more weight, and she was healthy.
I came to midwifery, I came to birth work through a decolonization, anti-colonial lens, and so primarily learning about the history of oppression and the histories of colonialism that our peoples have faced. I was able to plug that into a midwifery context and a birth context very quickly. And so for me, breastfeeding wasn't just an act of nutrition, it wasn't just an act of bonding, but it was an act of active resistance to colonization and the colonial mentality. It was my way of personally reclaiming a long-standing tradition and worldview and way of interacting and way of relationality with my children that has been actively stripped and actively demeaned by colonizer society. By the time that I'd had my own children, I had spent hundreds of hours helping other new mothers breastfeed. And so it was something that I always had faith in, something that I always had seen that worked. My mother breastfed me and my two brothers, and so it was something that I always, I had grown up with knowing was normal, even though my family was the only one I actively saw doing it when I was a child. With my first son, it took a minute. It took a solid 18 hours to get him to latch the first time. And the only reason I know that I kept doing it was because I knew I had faith that it worked. Because I had all of this experience behind me, but it was still a struggle. And I really, mad shout out to my partner. I remember one night at 3 in the morning where it hurt and I was crying and I couldn't do it anymore, and I was freaking out. And my husband, rather than go for the bottle at the bottom of go for the bottle in the kitchen, he took the baby from me and he said, go in the other room, pull it together, come back, and we'll do it again. And it worked, and we went on to breastfeed for 4.5 years together. And so now with my second son, we are 5.5 months into our breastfeeding journey and our relationship together.
There's a lot of evidence that supports that could be a huge contribution to why he's so healthy. I know when I was growing up, I was not breastfed past about 6 months. I had a lot of ear infections, and I know that breastfeeding can also prevent or help with any ear issues or ear infections, and he's never had an ear infection, so I was always worried he would get that from me, and he's just so incredibly indestructible in a way. And I think he's a healthy, if not above average in activity and intelligence. I feel like breastfeeding was a process that not only helped me stave off certain diseases like breast cancer or depression. I know the bond and the ability to give my son what I think the best chance that I can give him for health and immunity because of the antibodies that we pass from breast milk to our children. And I understand that a lot of good microbiome, digestive health comes from breastfeeding our children as well. So, there's so many numerous benefits that we're, from a research science point, still trying to understand. But what we do know is there are so many benefits to the mother and to the child. Spiritually, emotionally, physically, I feel like it all blends together in that way that we get to do this comforting process for our children while providing them that nutrition and that bonding, those bonding moments, that one thing that I get to share with just him and he gets to share with just me as he's getting older. So I'm an evaluation specialist and I am in the research and evaluation team. And so something that really blows me away is this, I'll just do one statistic. Breast cancer is the #1 diagnosed cancer for women across the nation in Indian country. I've looked at it from different angles, from different regions, from different tribes. There's a lot of different disparities if you bring it to those individual sovereign nations. But across the board, breast cancer is the #1 diagnosed. So that's a big deal. And I think about that when I think about breastfeeding my son and hoping that I get some of the benefits of breastfeeding. So the benefits to me, your chances of breast cancer are reduced, certain kinds of breast cancer. And the more you breastfeed, the greater your risk is reduced. So those are some studies that have been done and substantiated now for several years. I think also it's good to mention that some more studies are being done suggesting that reproductive cancers in general and uterine cancer can be prevented.
To my knowledge, I know that we're able to diagnose breast cancer quicker because we know more and we know what to look for. I know there are therapies out there that help people, or help women and men survive breast cancer. I think for one, you should do a monthly exam and feel for symmetry to make sure they both feel relatively the same. There are going to be the lumpy, bumpy tissue. And if you are concerned, go and get it checked out. It's better to be safe than sorry.
Milk and honey are the 2 only substances in the entire world which are created only to be food. It's the only function that they serve. Everything else, even the things that we eat, don't just exist to be food. When we take and we harvest animals, right, they exist on their own autonomy. We kill them, we consume them, right? We have that relationship between them. Plants, many of them, we kill and then consume. Or we are consuming the things that bear their seeds under the agreement, the promise that we will propagate those seeds into the future. It is the epitome of epigenetic food that we grant to our babies. It's literally It's literally the food of our ancestors that we can manufacture within our bodies. Within the forge of our bodies, we make these humans, we birth them, and we are able to nourish them into the future. And that's nothing short of miraculous. It's utterly fantastic. As aunties, as mothers, as grandmothers, we need to educate ourselves in nursing, in how to nurse children, so that when younger people are struggling, we can offer constructive help, right? Not give them a bottle, not, oh, do this and then try again later, or not, oh, well, it's supposed to hurt, your nipples will toughen up. We always have to be very compassionate with our young ones, with our youth, right? You know, we as Native people in general, there's a common belief that our children are stars that have come down to us, right? Which still means that even if my star is 18 years old, they are still my star, right? And I still have an obligation to treat them with all of the love and compassion I would have treated them with when they were 2. We get the honor and the privilege of making things different for our children, however that looks.